Hi, you guys. Hope you're having a good afternoon so far. So I'm pre-recording the lectures. I'll probably do it in two parts, so you can listen to one and then maybe take a little break and come back and listen to the other. I'm going to briefly go through the PowerPoint on laboratory materials and procedures, and then on your own time, please go more in depth and review each slide of this PowerPoint. Also, you have homework due next Friday on chapter 46 and 47. So using this PowerPoint and then reading chapter 47 in the book will help you understand the material. A lot of it we've already kind of talked about throughout lab, so hopefully most of it will be a bit of review for you. I'm also planning to maybe post a little discussion, so I will confirm that via an announcement on Canvas if I do end up doing that. Okay, so let's jump into laboratory materials and procedures. So we all know the dental lab is where we fabricate many different appliances that are used in the mouth. There's a lab that is in our office, and then there's also labs outside of the office where crowns and other removable prosthodontics are made. So in the office, in the dental laboratory, we use it for pouring models, trimming and finishing models, preparing custom trays, and polishing different types of prosthetics or restorations before we cement them or seat them in the mouth. You can read through the laboratory rules and safety in the lab. Most importantly is knowing where your fire extinguisher is. We do sometimes work with open flames and other heat sources in the lab, so it's important that we understand how to work safely with those items. As far as chemical safety goes, you want to make sure that you're wearing your PPEs at all times as needed. Chemicals sometimes can be dangerous and maybe a completely clear liquid that you wouldn't otherwise see. So it's important to make sure that you understand what you're using and how to properly use it. There's of course biohazards present because anything that's brought into the lab could harbor blood, saliva, or other infectious materials. So we need to make sure that we disinfect our lab equipment and whatever prosthetic or removable item that we're working on. So different types of dental lab equipment. We have our work pans, which you guys have seen. We've used these to store our models. In the office, these might be used to store preliminary impressions or lab cases that are out being made, the crown's being made, and there's a 2-week period where maybe other impressions or models are sitting in that pan waiting until the final product is returned to office. Once that's all taken care of, then the doctor would, remove all items from the pan once the procedure is complete and dispose of it as needed. The little metal clip holds the lab slip on it, or maybe a note with the patient's name and whatever it is that's being done on that patient. The heat source, this is why we need to know where our fire extinguisher is. So you might use it to heat wax or other materials. It might be a torch or a Bunsen burner, just like we used to use in our chemistry classes. It's important to always remember to turn all gas and heat off to prevent fires. The model trimmer, we have used this. All of you have used this by the time you'll be listening to this lecture. Our model trimmers look fairly similar to this. As I reiterated in lab, I'm very passionate about keeping it very clean so that everything's staying in working order. So it's super important with these trimmers to make sure that water's running so that running enough so that the plaster is being washed away from the sanding disc as it's going. And once that sanding disc is caked up with plaster, it's not going to be as effective anymore. The vacuum former. So we'll be using this next week, I believe, doing our custom bleach trays. This is a really fun piece of equipment, but it does have a heat heating element in the top portion. That this little square on top here is a little heating coil similar to what you might see in an electric oven. And it's completely open and exposed. So we need to make sure we don't burn ourselves and also don't leave it plugged in or leave the heating element on and go home for the night. The vibrator, you guys have used this. This can be used to remove air from plaster or stone while you're mixing. It's a great idea to use a disposable cover. I think we have shower caps in lab. In my office as an assistant, we would just wrap a paper towel around the top of it because plaster gets messy, as you all know. And so putting something over this just makes it that much easier to clean. You can just pull it off, throw it away, and then move on to the next thing. The laboratory handpiece. So we've talked about this a bit in lab. It can be, our Dremels are a type of laboratory handpiece that we use when we're making our temporary crowns. You can also use the slow speed handpiece on the dental unit with a straight attachment. And then some dental offices have these external little laboratory handpieces that have a little bit more in-depth controls to them than our simple little Dremels do. These are used for trimming custom impression trays, adjusting dentures, and polishing provisional and indirect restorations. The sandblaster. This is a little unit that sits on top of the table in the lab, and it sprays a type of sand at a high rate to etch metals, porcelain, or acrylic. This helps create added retention through surface roughening. So basically on those crowns, on the inside of them before they're cemented, the doctor would take this little sandblasting machine, which has a little small handpiece that sprays sand out of it, and they would spray or blast the inside of the crown. So the inside of the crown was smooth, and then the doctor blasts it, and it creates these tiny little microscopic pits within the surface of the interior of the crown. And that way, when the crown is cemented, it has extra retention because the cement is being applied to a rougher surface. So there's more chances of that sort of mechanical retention locking the cement into the crown. The dental lathe is used to polish or trim custom trays, provisionals, dentures, and indirect restorations. It's typically used with the rag wheel. As you can see in this picture, it's just a wheel that's made of cloth. These must be sterilized after each use. So it's best practice to disinfect whatever item it is that you're going to be polishing, whether it's a tray or a denture. Spray wipe, spray it, and then polish it, and then of course rinse it off if the patient's coming in immediately after. But then the rag wheel also needs to be sterilized after the use. So you can just bag this, and it's autoclavable. So you can just put it in the autoclave. So we know a lot about these bowls. We've used them a few times to mix alginate and plaster. With lab items in general, I can't express how important it is to keep everything clean. So your tools, your bowls, you want to make sure you clean them. There's no bits of debris left on the tools or in the bowls, because if you leave a little bit each time you use these items, they're going to end up being totally not well working, and they're going to be harder to use when you're going to use them. So it's super important that you keep everything nice and clean and free of any excess debris after you've used it, because it'll only make your job that much harder in the long run if you're rushing to go do something and you have dirty instruments or dirty bowls that aren't ready to be used. The articulator is a device that is used to aid in reproduction of the mandible in relation to the maxilla. So the articulator basically helps the dental laboratory technician visualize how the patient's teeth or upper and lower arches come together. So the models get sent in to the dental lab, and then the laboratory technician will mount those models onto this articulator, which is the big metal framework. And then they can open and close that and determine how tall they might need to make their dentures or whatever prosthodontic they're making. So the big metal framework is called the articulator. The face bow is another apparatus that is used in office, and this is a measuring tool used to determine the positional relationship of the maxilla to the TMJ. So understand the difference between articulator and face bow. The face bow is measuring the relationship between the maxilla and the TMJ. The articulator is showing the reproduction of the mandible in relation to the maxilla. So the articulator is showing the relation of upper and lower arches. The face bow is showing the relationship of the maxilla to the TMJ. We'll be going over how to take a face bow measurement in our 156 impression materials lab in a few weeks. And I also have a supplemental video for you guys to view at the end of this PowerPoint. So let me just scroll down real quick to the last slide here. I want you guys to watch each of these videos at the end of this PowerPoint. The PowerPoint's on the home page of Canvas, Chapter 47 PowerPoint. I want you to watch each of these videos because it's going to clarify different things that we've talked about in this PowerPoint that might be a little bit foggy for you. So please take the time. They're just a few minutes each, but the face bow transfer will definitely clarify how to take a face bow transfer and kind of help you understand what it's used for. I also have it broken down on slides here. You don't need to memorize these slides or the procedure because we'll be going through it in lab. But feel free to kind of browse through these and take a look at the pictures before you watch the video. My hope is that kind of doing the combination of watching the video, reading the PowerPoint, and then doing it in lab will help you all understand how to use those. Face bows some dentists use them for every removable prosthodontic procedure. Other dentists never use them. So it's an important tool to understand why it's used, but it may not be used in every office. So just something to understand how to use it, but it's not something that you all might be doing routinely. So let me see. So next we'll be going into dental models, and I think what I'll do is stop this PowerPoint and then I'm going to, or stop this video lecture, and then I'll go ahead and record a new one so you guys can kind of pause, take a little break, and then we'll come back and finish up the last bit of slides. And then again, I want to make sure that you all review this PowerPoint in depth on your own time. My lecture is just kind of an accessory to this for this afternoon, and then we can go ahead and clarify anything next week that you guys might be a little confused on.